Sentinel event, suicide of a patient in and around the clock care.
A sentinel event is an unexpected occurrence involving death or serious physical or physiological injury or the risk thereof.
Suicide of any patient receiving care, treatment, and services in an staffed around-the-clock care setting or within 72 hours of discharge, including from the hospital's emergency department, is considered a sentinel event.
Beyonce Carter, a 28-year-old female, was admitted to the hospital due to a 5150 called in by the city police. Upon admittance, her initial vital signs were out of normal range due to malnutrition, so she was placed on excess fluids with round-the-clock care regarding her mental state. In the beginning of her hospital stay, she was showing signs of self-harm, such as trying to pull out her IVs and denying meals. Within a few hours, as her vital signs began to reflect normal ranges, she was becoming more cooperative with nurses and staff in regards to her care. A few days had gone by, and nurses felt she displayed signs of emotional progression because she was eating and socializing more with the hospital staff. There were occasions that she would often stare out the window in silence, but the nurses and staff didn't believe that behavior was alarming.
Miss Carter eventually asked to use the phone from time to time to talk to a close friend who was anxious to see. She told the nurses that this friend, Lou, would come to visit her soon and that she couldn't wait to see a familiar face. But what the nurses and doctors didn't know was that Beyonce was asking Lou to bring some sweet drugs because she wanted to kill herself. Her friend, unfortunately, had no problem with listing her to suicide. After 3 days in the hospital, Lou finally showed up and visited with Beyonce for about an hour. Lou brought a pill laced with Sentinel and told Beyonce to wait until she left to take it. During the visit, nurses refrained from doing their round-the-clock check on Beyonce, which was against the protocol of her needed care. This created the perfect opportunity for Blue to secretly hand the narcotics to Beyonce. About an hour after Blue left, Beyonce took the pills, put it shortly after, but was unable to be resuscitated by the nurses. Due to them not knowing what was causing her code, she died in the hospital due to the overdose.
Causes of sentinel events. Ineffective communication is one of the most identified primary cause of sentinel events. Failure of staff to speak up when they know something is wrong that could potentially cause harm to the patient. Fatigue can be one of the causes of sentinel events. With a shortage of healthcare providers and working long hours, this might contribute to errors because of fatigue. Complacency relating to the healthcare providers who overlook patients' conditions and are lazy to check on patients as they are supposed to, but delay attending to patients in time. Incorrect assessment of patient condition, inadequate leadership, orientation, and training. Lack of ongoing training might be caused by high workload.
According to the Joint Commission, asphyxiation, hanging, gunshots, drug overdose, jumping from a height, jumping in front of a vehicle, laceration are the most common ways of inpatient suicide. 1,500 inpatient suicides occur in the United States each year. Of the 35,000 or more suicides per year in the United States, about 1,800, 6% are inpatient suicides. Most common inpatient suicides occur in the patient's bathroom, bedroom, or closet.
Since 2007, about 800 sentinel events are reported to the Joint Commission every year. It is estimated that between 48.5 and 64.9 hospital inpatient suicides occur per year in the United States. Of these, 31 to 51.7 are expected to involve psychiatric inpatients. Hanging was one of the most common method of inpatient suicides in the NBDRS.
Real-life examples. Terrence Van Dyke lived with undiagnosed all-over body pain for 4 to 5 months. He told his family he couldn't live with the pain anymore and feared it was a manifestation of a terminal condition. He attempted suicide one night, but his wife walked in and stopped him. That same day, he and his stepson went to the ER and waited 8 hours before being seen by a doctor. The doctor was informed about his ongoing pain, suicide attempt, and suicidal thoughts, and stated there was nothing they could do. The stepson left for work around 6:30 a.m. and Van Dyke was discharged alone, being escorted out by security because he was getting loud saying he needed help. Later that day, Van Dyke wrote a 4-page letter to his family and took his own life in the bathtub of their own home. Another real-life example is, in January of 2010, a man with suicidal ideation was admitted involuntarily to a hospital. Prior to this, he had already attempted suicide twice, but his father had intervened both times. The next day, he was sent to an acute care psychiatric facility, and the doctor placed him on a 15-minute observation status. After being interviewed by the psychiatrist and an unlicensed social worker, he was found to be calm and cooperative without suicidal ideation. At 3:50 p.m., the psychology technician on duty exited this patient's room and went to ask a staff member about who had been assigned room checks. Then, at 4:15 p.m., the psychology technician went to the patient's room and found him in the bathroom hanging from the inside of the door with a sheet tied around his neck.
Solutions to prevent this from happening again. Develop communicative therapeutic relationships with our patients. By providing patients with an emotionally safe and supportive environment, nurses can build a trusting relationship that may improve the effectiveness of interventions. Understand suicide risk factors at every level. Suicide risk factors are generally defined as any factors within an individual's life that are likely to increase the chances that the person in question may consider or actually attempt suicide. Team members should receive proper training and competency on how to monitor and prevent industry suicide. Use an environmental checklist to remove items that pose a risk for climate.
Additional ways to prevent suicide in the hospital. Screen all patients for suicide ideation using a brief, standardized, evidence-based screening tool. In the waiting room, you can include a questionnaire specifically asking the patient if they had thoughts about killing him or herself, which can help identify individuals at risk for suicide. Another thing you can do is educate all staff in inpatient care settings about how to identify and respond to patients with suicide ideation. Education for staff should cover environmental risk factors, finding help in emergencies and policies for screening, assessment, referral, treatment, safety, and support of patients at risk for suicide. Also, screening visitors of patients. Visitors must be screened for potentially lethal objects such as ropes, bags, and lethal drugs. This preventable measure could provide a safer environment for patients. Advanced medical care. Providing care that aids in the deterrence of suicidal behavior during inpatient care can include modern technology such as repetitive transcranial magnetic stimulation. This procedure involves an electromagnetic coil that is placed against your scalp near your forehead. The electromagnet painlessly delivers a magnetic pulse that stimulates nerve cells in the region of your brain involved in mood control and depression.